Hey, Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 20 practice NCLEX questions. Without the way, let's get started.
When an infant with pyloric stenosis is admitted to the hospital, which of the following should the nurse do first? 1. Weigh the infant. 2. Begin an intravenous infusion. 3. Switch the infant to an oral electrolyte solution. 4. Orient the mother to the hospital unit. The correct answer is 1. Unless the infant is in hypovolemic shock. Obtaining a baseline weight is an important first action because the weight is used to calculate the child's fluid and electrolyte needs. The primary healthcare provider prescribes intermittent fetal heart rate monitoring for a 20-year-old obese prima gravida client at 40 weeks gestation in the first stage of labor. The nurse should monitor the client's fetal heart rate pattern at which of the following intervals? 1. Every 15 minutes during the latent phase. 2. Every 30 minutes during the active phase. 3. Every 60 minutes during the initial phase. 4. Every 2 hours during the transition phase. The correct answer is 2. Labor is categorized into 3 phases: latent, active, and transition. During the active stage of labor, intermittent fetal monitoring is performed every 30 minutes to detect changes in fetal heart rate. The nurse is caring for a prima gravida client in active labor at 42 weeks gestation. The client has had no analgesia or anesthesia and has been pushing for 2 hours. The nurse can be most helpful to this client by 1. Changing her pushing position every 15 minutes. 2. Notifying a healthcare provider of her current status. 3. Continuing with current pushing technique. 4. Assessing the client's current pain and fetal status. The correct answer is 2. The normal length of time for pushing is 2 hours. Anything over that time becomes an abnormal situation, and the healthcare provider needs to be notified. Which of the following would the nurse include in the teaching plan for a 16-year-old prima gravida client in early labor concerning active relaxation techniques to help her cope with pain? 1. Relaxing uninvolved body muscles during uterine contractions. 2. Practicing being in a deep meditative, sleep-like state. 3. Focusing on an object in a room during contractions. 4. Breathing rapidly and deeply between contractions. The correct answer is 1. Childbirth educators use various techniques and methods to prepare parents for labor and birth. Active relaxation involves relaxing uninvolved muscle groups while contracting a specific group and using chest breathing techniques to lift the diaphragm off the contracting uterus. The primary healthcare provider prescribes an amniocentesis for a prima gravida client at 35 weeks gestation in early labor to determine fetal lung maturity. Which of the following is an indicator of fetal lung maturity? 1. Amount of bilirubin present. 2. Presence of red blood cells. 3. Bar body determination. 4. Lecithin sphingomyelin. The correct answer is 4. To determine fetal lung maturity, the sample of amniotic fluid will be tested for the L/S ratio. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse explains to a newly admitted prima gravida client in active labor that, according to the gait control theory of pain, a closed gait means that the client should experience which of the following? 1. No pain. 2. Sharp pain. 3. Light pain. 4. Moderate pain. The correct answer is 1. According to the gait control theory of pain, a closed gait means that the client should feel no pain. A prima gravida client in active labor has had no anesthesia. The client's cervix is 7 centimeters dilated, and she is starting to feel considerable discomfort during contractions. The nurse should instruct the client to change from slow chest breathing to which of the following? 1. Rapid, shallow chest breathing. 2. Deep chest breathing. 3. Rapid pant-blow breathing. 4. Slow abdominal breathing. The correct answer is 1. The psychoprophylaxis method of childbirth suggests using slow chest breathing until it becomes ineffective during labor contractions, then switching to shallow chest breathing. The stigma related to having a mental illness, especially a chronic illness, persists despite improvements in the management of illnesses and an increase in public education. Which of the following views most perpetuates the stigma? 1. Mental illness is hereditary. 2. Mental illnesses have biochemical bases. 3. Clients cannot prevent mental illness if they want to do so. 4. Clients can recover from mental illness if they have willpower. The correct answer is 4. Many still believe that recovery from mental illness is a matter of willpower. For example, pull yourself up by your bootstraps or just get over it. This belief persists despite awareness that mental illness is hereditary and has a biochemical basis. Transferred data for a client brought by ambulance to the hospital's psychiatric unit from a nursing home indicate that the client has become increasingly confused and disoriented. The client's behavior is found to be the result of cerebral arteriosclerosis. Which of the following behaviors of the nursing staff should positively influence the client's behavior? Select all that apply. 1. Limiting the client's choices. 2. Accepting the client as he is. 3. Allowing the client to do as he wishes. 4. Acting nonchalantly. 5. Explaining to the client what he needs to do step by step. The correct answers are 1, 2, and 5. Confused clients need fewer choices, acceptance as a person, and step-by-step directions. A client has been in the critical care unit for 3 days following a severe myocardial infarction. Although he is medically stable, he has begun to have fluctuating episodes of consciousness, illogical thinking, and anxiety. He is picking at the air to catch these baby angels fly around my head. While waiting for medical and psychiatric consults, the nurse must intervene with the client's needs. Which of the following needs have the highest priority? Select all that apply. 1. Decreasing as much foreign stimuli as possible. 2. Avoiding challenging the client's perceptions about baby angels. 3. Orienting the client about his medical condition. 4. Gently presenting reality as needed. 5. Calling the client's family to report his onset of dementia. The correct answers are 1, 2, and 4. The abnormal stimuli of the critical care unit can aggravate the symptoms of delirium. Arguing with hallucinations is inappropriate. When a client has illogical thinking, gently presenting reality is appropriate. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse interprets which of the following as an early sign of acute respiratory distress syndrome in a client at risk? 1. Elevated carbon dioxide level. 2. Hypoxia not responsive to oxygen therapy. 3. Metabolic acidosis. 4. Severe unexplained electrolyte imbalance. The correct answer is 2. A hallmark of early ARDS is refractory hypoxemia. A client has the following arterial blood gas values: pH 7.52, PaO 250, PaCO 228, HCO 324. The nurse determines that which of the following is a possible cause for these findings? 1. Chronic obstructive pulmonary disease. 2. Diabetic ketoacidosis with Kussmaul's respirations. 3. Myocardial infarction. 4. Pulmonary embolus. The correct answer is 4. PaCO2 of 28 and PaO2 of 50 are both abnormal. The PaO2 of 50 signifies acute respiratory failure. In evaluating possible causes for this disorder, the nurse should consider conditions that lead to hypoxia and hyperventilation, such as pulmonary embolus. While making rounds, the nurse finds a client with COPD sitting in a wheelchair, slumped over a lunch tray. After determining the client is unresponsive and calling for help, the nurse's first action should be to 1. Push the emergency response button. 2. Call the rapid response team. 3. Open the client's airway. 4. call for a defibrillator? The correct answer is 3. The nurse has already called for help and established unresponsiveness, so the first action is to open the client's airway. After surgery to repair a tracheoesophageal fistula, an infant receives gastrostomy tube feedings. After feeding the infant by this method, the nurse cradles and rocks the infant for about 15 minutes, primarily to help accomplish which of the following? 1. Promote intestinal peristalsis. 2. Prevent regurgitation of formula. 3. Relieve pressure on the surgical site. 4. Associate eating with a pleasurable experience. The correct answer is 4. The nurse can help meet the psychological needs of an infant being fed through a gastrostomy tube by rocking the infant after feeding. The infant soon learns to associate eating with a pleasurable experience and learns to trust the caregiver. Which of the following behaviors exhibited by the parents of an infant with pyloric stenosis should the nurse correctly interpret as a positive indication of parental coping? 1. Telling the nurse that they have to get away for a while. 2. Discussing the infant's care realistically. 3. Repeatedly asking if their child is normal. 4. Exhibiting fear that they will disturb the infant. The correct answer is 2. The parent's ability to verbalize the infant's care realistically indicates that they are working through their fears and concerns. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. While caring for a moderately obese prima gravida client in active labor at term, the nurse should monitor the client for signs of which of the following? 1. Hypotonic reflexes. 2. Increased uterine resting tone. 3. Soft tissue dystocia. 4. Increased fear and anxiety. The correct answer is 3. The obese pregnant client is more susceptible to soft tissue dystocia. The nurse is performing effleurage for a prima gravida client in early labor. The nurse should do which of the following? 1. Deep kneading of superficial muscles. 2. Secure grasping of muscular tissues. 3. Light stroking of the skin surface. 4. Prolonged pressure on specific sites. The correct answer is 3. Light stroking of the skin, or effleurage, is commonly used with the Lamaze method of childbirth preparation. Light abdominal massage with just enough pressure to avoid tickling is thought to displace the pain sensation during a contraction. A 19-year-old prima gravida client at 38 weeks gestation is 7 centimeters dilated and the presenting part is at +1 station. The client tells a nurse, "I need to push." Which of the following would the nurse do next? 1. Use the McDonald procedure to widen the pelvic opening. 2. Increase the rate of oxygen and intravenous fluids. 3. Instruct the client to use a pant blow pattern of breathing. 4. Tell the client to push only when absolutely necessary. The correct answer is 3. Pushing during the first stage of labor, when the urge is felt but the cervix is not completely dilated, may produce cervical swelling, making labor more difficult. The client should be encouraged to use a pant blow pattern of breathing to help overcome the urge to push. Before placing the fetal monitoring device on a prima gravida client's fundus, the nurse performs Leopold's maneuvers. When performing the third maneuver, the nurse explains that this maneuver is done for which of the following reasons? 1. To determine whether the fetal presenting part is engaged. 2. To locate the fetal cephalic prominence. 3. To distinguish between a breech and a cephalic presentation. 4. To locate the position of the fetal arms and legs. The correct answer is 1. Leopold maneuvers are performed to determine the presentation and position of the fetus. When caring for the client diagnosed with delirium, which condition is the most important for the nurse to investigate? 1. Cancer of any kind. 2. Impaired hearing. 3. Prescription drug intoxication. 4. Heart failure. The correct answer is 3. Polypharmacy is much more common in the elderly. Drug interactions increase the incidence of intoxication from prescribed medications. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.